Jai Shri Krishna, a very warm welcome to the day 2 of my YouTube channel Dental Tips. Today we are going to discuss about the 4 tissues of a tooth. Every tooth has 2 parts, coronal part which is crown, which is located above the gum line and is visible in the oral cavity, and root part which is radicular part which is located in the jawbone, and the portion of the jawbone which houses the root is called dental alveoli or socket. Now every tooth it has 4 basic dental tissues. What are those? They are enamel, dentine, pulp and cementum. Enamel is the outermost layer and it is the hardest tissue of our whole human body, and it is known as substantia adamantina. Now enamel, it comprises more than 95% of the inorganic part and less than 5% of the organic part. Now why is there a need for the enamel to be so hard? Because enamel is the outermost portion of the tooth, so that when we chew the food and masticatory forces act on the enamel, it can withstand the masticatory forces. So there is a necessity of it to be so hard. Another thing is that enamel is not a living tissue, and once it is destroyed, it is lost forever. And the next tissue we are going to discuss is about dentine. Dentine is located in the crown portion of the tooth as well as in the root portion of the tooth, and it forms the majority of the tooth. Now dentine is known as substantia eburnica. Now dentine, where it comes to the hardness of dentine, its hardness is similar to that of compact bone of skeletal tissue, and a portion of the tubules may come from the pulp into dentine. Now we come to the third tissue, that is pulp. Pulp is a soft mesenchymal tissue which is again present in the root portion of a tooth as well as in the crown portion of the tooth. And pulp comprises of blood vessels, it comprises of nerves, it comprises of lymphatics, and it is a living tissue. So the portion of the pulp that is present in the coronal portion of the tooth, that is crown portion of the tooth, is called pulp chamber, and the portion of the pulp that is present in the root portion of the tooth is called pulp canal. Now we come to the fourth part, that is cementum. Now cementum, it is known as substantia ossia. Cementum is again present in the root portion of the tooth, and cementum to that periodontal ligament fibers are attached. So that's all for today, and thank you for watching my channel. Hare Krishna.